Hi, welcome once again to Healthcare Hoax Videos. I'm Janet Cimorelli. I'm here with Dr. Herb Slavin, and today we have lots of information to share with you with regard to the importance of maintaining the right level of all the different nutrients in your body. That when you don't have the correct level of a variety of different nutrients, certain systems of your body don't work very well. And you can test to see if you are nutrient deficient in any way. And you might very well find that some of those nutrient deficiencies are specifically associated with certain diagnoses. Dr. Slavin, you work with plenty of your patients regarding nutrient deficiencies. How big a problem is it?
Well, nutrient deficiencies are very common. However, you don't know it. I was thinking of a good way to help my patients understand how could they be nutrient deficient and still feel okay. So here's what I thought of. I said, all right, think about your car. Can you drive your car even when the oil in the engine is very low? Of course you can. Can you drive your car if you don't have adequate air in the tires? Sure you can. You can even drive your car for a short time with no gasoline in the engine because there's still a little left in to burn. So yes, you can drive it, but you're not going to drive it for long, and then it's going to break really fast. It's not going to last. And that's what happens with your body. If you deprive your body of these important nutrients, yeah, you'll be able to function. You know, you'll wake up, you'll go to work every day, but you're not going to be able to do it for as long as if you corrected any deficiencies. So the next question is, how do you detect deficiencies? You have to test. You know, it's not even enough to say, well, I'm eating a good diet, or at least a diet you think is good. That's not enough. It's not enough to say, well, I'm taking lots of vitamins. You know, you have to really test what your body is actually absorbing and able to utilize to know if you're getting adequate nutrition. So that's what we focus on, and the reason that's so important, that's the difference between people that are on lots of medications or constantly going into the hospital and the ones that are healthy and functional, not taking medications. And believe it or not, I have lots of patients in their 70s and 80s on no medication.
Dr. Slavin, is it ever an issue that some of the medications could contribute to a nutrient deficiency?
Absolutely, definitely, and a lot of the common ones, and a lot of the over-the-counter medications that you can go and buy yourself without a doctor's prescription. For example, the acid blockers. It's going to create nutrient deficiencies. For one example, I think even oral contraceptives can create nutrient deficiencies. So a lot of the things that we do, not even thinking in terms of creating malnutrition, could possibly be doing it.
With regard to oral contraceptives, I think unfortunately so many young women don't realize that the B complex is compromised with oral contraceptives, and among those B complex nutrients, folic acid, folate, is tending toward the low side, a critically important nutrient once that young woman is planning to come off the oral contraceptive and seeking to start a family. Very important information.
Well, you know, you bring up a certain group of people, women that anticipate getting pregnant. They have to prepare a year in advance, if not longer, for that pregnancy. Otherwise, you're risking problems during the pregnancy, problems for the newborn due to nutrient deficiencies. The most common nutrient deficiencies, it's very important because when you go to your doctor, he's not checking for nutrient deficiencies, but they're going to undermine your health in the long term. So why not take the steps to prevent these deficiencies? And these are just the top of the list. These aren't even, I mean, you can have a lot more deficiencies than this. But
Your doctor may very well be contributing to your nutrient deficiencies. So you think about any kind of fat-soluble nutrient, your cholesterol-lowering drug is going to interfere with the utilization of A and D and E.
right, so on the list of the most common nutrient deficiencies, top of the list is vitamin D. Every patient I see that is not taking a vitamin D supplement is deficient in vitamin D, period. So if you're not taking a vitamin D supplement, you're deficient, get your levels checked, and then corrected. Vitamin D is important because it's going to help your immune system. It's been associated with a lower incidence of many different types of cancer, a lower incidence of multiple sclerosis, even protection against the flu. So it just makes sense, not to be deficient in that.
Okay, you are in trouble.
No, I think we can.
Okay.
So omega-3s, that's your fish oil. They have a test for that. You don't have to guess. Have your levels checked. Make sure you're getting enough. Some people can do it with their diet if they're eating a lot of cold water fish. But most people, I'm guessing, probably aren't. So the likelihood is you're deficient. The omega-3s are going to be cardioprotective, and they're also anti-inflammatory. These are good things to take. Magnesium, probably the most common mineral deficiency out there, but nobody checks for it. They might be checking calcium, but they're not checking magnesium. It's not routinely done on your chemistry panel that the doctor orders. That panel will check calcium and potassium and sodium chloride, but they're not checking magnesium.
How appropriate is it to test serum magnesium?
No, you don't want to check serum magnesium. You have to check, the one that's easily available is red blood cell magnesium. In other words, an intracellular magnesium level, because that's where it's found.
You know what I've heard from some of my clients is that Medicare is refusing to pay for a vitamin D test so you can determine what your vitamin D level is, and they will not pay for the red blood cell magnesium level. The only one that they will test and pay for is serum magnesium, which is just as good as doing nothing.
Right, it's a worthless test. I haven't experienced that problem yet with Medicare, but then I'm using different labs that are more in tune with this type of medicine than the common labs that doctors use that start with a Q and an L.
Those? Okay.
Okay, so you said magnesium is common, vitamin A, vitamin E, B12, iodine, calcium, iron, and zinc. These all need to be checked to make sure you're not deficient.
I can't remember the last time, I don't think it happened, that any blood work from a mainstream practitioner came across my desk where they checked iodine, in spite of the fact that the patient may very well have been a long time thyroid issue patient.
Yeah, they don't check it. So, like I pointed out when we started it, your body can function with these deficiencies, but you're going to be at a greater risk to get sick. Cardiovascular disease, cancer, endocrine issues, osteoporosis. I mean, you name the illness, you're at greater risk if you're running deficiencies in your nutrients. And it's a very simple thing to correct. And another thing, when you go to your doctor with all these symptoms that are based on these deficiencies, they don't give you the nutrient to correct the deficiency, they just give you a drug to cover up the symptom. And that further makes the problem worse. So that's what we're trying to do. This is the hoax of mainstream medicine, where they think they're getting you well by giving you a drug, and you think just because you feel better that you're getting well, but you're really not.
or just because a certain number might change on blood tests or certain tests that you are doing with your physician because you've been given a pharmaceutical. The truth of the matter is, by correcting the nutrient deficiency, you actually are supporting health. By using a synthetic chemical pharmaceutical, what you're doing is merely changing or possibly changing numbers on a test, but it has nothing to do with supporting good health.
And if you're having trouble getting your doctor to order these tests for you, or in many cases, LabCorp or Quest don't provide these tests, or your insurance doesn't cover it, we use other labs that work with your insurance and can get these tests covered. So you can give our office a call, and we can tell you how we can help you out. 954-748-4991. And find out. You have to be more proactive when it comes to your health, because ultimately you're the only one responsible for your health. The doctors are just treating symptoms. They're not making you healthy. And the sooner you realize that, the better off you're going to be.
Can you work with people who might not have insurance, or let's say their deductible is so high that they actually want to pay out of pocket for their blood tests?
Sure, we have patients in that situation, these days especially. Sometimes you have insurance, it's like having no insurance because you have to spend so much money before you get any coverage. So we can streamline the lab orders and get specific of what we want to check so you can get the information you need to take better care of yourself.
So it isn't sufficient just to say, I eat a really high quality diet, I'm very aware of vegetables in my daily routine, I have a focus on supporting my good health because of the diet that I choose, and supporting my good health because of the things that I specifically avoid that would be detrimental to my long-term health. And one of the ways to kind of thread the maze of this so-called healthcare hoax is to do the proper testing, and that's what we're about here, educating you on what the tests are that are available so that you can monitor your progress, so you can make sure that you are actually supporting your health and well-being by avoiding nutrient deficiencies. You've been tuned to Healthcare Hoax Videos. Remember, share these videos, and when you sign up for healthcarehoaxvideos.com, you'll get a notice that the next video has been posted. Thanks for watching.